While the pandemic's toll is easing here in the U.S., it still has a firm, deadly grip on a number of other countries. The estimated global death toll from COVID-19 remains around 13,000 people a day, and the WHO's new estimates are far higher than many realize. William Brangham looks now at some of the implications.
Amna, things are indeed better in the U.S., but still, more than 600 people died from COVID-19 in America in the past 24 hours. Though in other countries, the official toll is many times higher and new infections keep climbing. India reported more than 4,200 deaths in the last day. Brazil, more than 2,400. In fact, 6 of the countries with the highest current death rates are in South America. And according to the WHO, that's likely a significant underestimate of the real toll, off by 3 to 4 million deaths at least. And for many of these nations, life-saving vaccines are barely available. Dr. Monica Gandhi specializes in infectious diseases and global medicine at the University of California, San Francisco. Dr. Gandhi, great to have you on the program. Do you think that these WHO estimates are accurate? And if those horrible numbers are real, what does that say about the real danger we are still in from this virus?
This is a very dangerous virus. And like you just said, there's this paradox of places that have vaccinated quickly and are wealthy and have access to those vaccines going back to normal and discussing when do we get to take off masks. And that paradox is completely out of sync with what's going on in so many places in this world. This is a highly deadly virus, but beyond that, health systems matter. So places where health systems aren't equipped to manage this load, don't have the oxygen, don't have the capacity, the fatality rate of this infection is going to be higher. And I'm not surprised, I'm sad, but I'm not surprised that the death toll, as the WHO said, is likely much higher, 13,000 a day.
You touched on, of course, what we know is the way out of this pandemic, which are these life-saving vaccines. What role should U.S. and the U.S. policymakers play in trying to accelerate the spread of those vaccines globally?
Yes, you're exactly right. The only way we can get out of this is vaccines, and we actually have the solution. We have it. And I think that the United States can play a role in 4 ways. I think that we want to go back to being that global health leader that we have played that role so often in the past. And the 4 ways really are something that we've already done, which is for the future, work with the WTO to temporarily waive vaccine patents. This has already been signaled that the Biden administration supports this. Other countries aren't signing on. It's important for them to keep on pushing on that, or the U.S., because this is for the future for countries that are not yet in trouble. For what countries that are in trouble right now, we need to donate or loan doses. And we do have excess doses. In fact, I wrote a piece in The Atlantic with others, and many people have echoed this, that our kids in this country could even wait to get their doses of vaccine to help people who are much, much more likely to get severe disease in other countries. And we do have surplus doses. Duke has actually estimated we have 300 million surplus doses. So though I appreciate the 20 million doses that President Biden signaled the other day, plus 60 million AstraZeneca, we have more than that. Third is that pharmaceutical companies should use philanthropy. This is a global health crisis. They will make money. They should use philanthropy. They should give doses. And I do believe the U.S. could help with urging them. And then fourth is the U.S. global role as convening the UN in terms of global manufacturing and really, along with the WHO, figuring out how to get vaccines immediately into places that are surging and later into places that are likely to surge.
I want to touch back on one of those points that you made, which is the Biden administration supporting temporarily waiving the patent rights for these vaccines. You wrote recently that back in the 1990s, during the HIV/AIDS epidemic, that adherence to patent rights killed millions of people in sub-Saharan Africa. Do you think in this debate we have given too much credence to pharmaceutical companies' arguments about this?
Yes, we have, because what I wrote about was that as an HIV doctor, I saw from 1996 to 2001 and even all the way to 2005 arguments about whether we should temporarily waive patents while millions died in sub-Saharan Africa of AIDS and people who are living with HIV in US and Europe had access to life-saving medications. The disparity was so great, and the arguments went on for so long, years and years, while people were dying. And finally, a lawsuit actually was filed by pharmaceutical companies against South Africa because they were purchasing cheaper drugs from India, who provided antiretroviral therapy to the world, who's now in trouble. And that lawsuit got so much international pressure to drop that the pharmaceutical companies dropped it, and it was recognized that this was terribly important, that if we have access to these medications, we can't let people die in other places. So yes, we have to work on vaccine patent waivers now, because if sub-Saharan Africa right now isn't hurting, COVID will eventually get everyone, it will come to every country until we can get them vaccinated.
All right, Dr. Monica Gandhi, UC San Francisco, thank you very much.
Thank you.